is it safe to take your child to go get a vaccination?
Yeah, it's a great question. And I would say absolutely the answer is yes. Everything has a risk and a benefit. So, what is the risk of your child not receiving vaccinations? Or let's transition to an adult. It's influenza season in the United States. We're just starting to ramp up on that. So, what's the risk of going into a pharmacy, into your healthcare provider to get your flu shot? Well, think about the risk of if you get influenza versus not getting your flu shot. So, you have to put it in perspective. I feel everybody should go and get their flu shot, pediatric and adults. And wherever that is, now keep in mind in the US, you can go to your local pharmacy and get a flu shot. You don't have to go into a private physician's office. But every physician's office is incredibly vigilant about COVID. I mean, if you can go to Walmart, you can go to your physician's office. They have a strategy to keep the waiting room clean, the sick people arrive at one place. You're not going to be sitting and commingling with people who are there because of an illness. Dental practices are up and running. And how are they keeping it safe? I mean, we have many models now that are doing it very
Dental
successfully.
dental really surprised me when I looked into how how little we've recorded actually transmission from people going to the dentist's office, for example. And I mean, it worries me when you think about the overall health of especially our older people who are prone to periodontitis.
Mhm.
Uh, if they're not getting to a dentist for not, just the 3 or 6 month interval, but so far, most probably haven't all year.
Right. Well, now I may have a slight bias. My husband is a dentist in private practice.
I didn't know
And
that. I wasn't buttering
yes, I think you
a
set me up for this. But actually, we are just in the process of starting a dental stewardship study, and that I actually can conduct
Oh, I
without.
actually I actually do remember I actually did know that because I've read about you
Yes,
wanting to start the study, yes.
yes. And so we are getting ready to start that study. But actually, dental offices have were one of the first to return to practice because they already have all these standards in place. I mean, dentists already wear gloves, they wear face masks, they wear shields because they're in your mouth. And, there's other things besides COVID that are transmitted potentially through dental work. And so they were very much ready to go back and successfully reopened practices, and you haven't seen transmission from a dental practice yet. So, I don't know if anybody's actually studying it, but it is very near and dear to me because my husband comes home every day after practicing in those patients' mouths. And so having a face shield, that's been standard practice. So really it was quite easy for the dental practices to go back. It was really more assuring the patient that they're not going to be sitting in a waiting room with other people as we were still learning about social distancing and all of that. So they've had a system just like my primary care physician has. You don't wait in an office, you wait in your car. And when they're ready, they text message you to come up. So you go right into the treatment room. There's no interacting with other people. It's very safe.